Welcome to the Making Educators Partners in Youth Suicide Prevention. The mission of the Society for the Prevention of Teen Suicide is to reduce the number of youth suicides and attempted suicides by encouraging public awareness through the development and promotion of educational training programs. The purpose of this training is to learn about youth suicide. This may be a difficult topic for some of you, and most of you can probably think of somewhere else you'd rather be. The ability to use the imagination creatively when we are in places we don't want to be is actually a resiliency skill called self-soothing. It is an important coping skill to keep in your bag of tricks, and it can really calm you and help recharge your emotional battery when you feel depleted. If the same question, where would you rather be, were asked of a suicidal student, the answer would not be about a fun or distracting activity. Most likely the answer to, where would you rather be, would be, I don't know, or I'd rather be dead. Suicidal children lose the ability to use fantasy in productive ways. This training gives you a little insight into how suicidal youth lack the capacity to use their imaginations to soothe themselves. It takes them to dark places instead. This training will review the ways in which suicide awareness training is beneficial to your schools and community. It will correct myths and misinformation about youth suicide, present accurate, evidence-based data about suicide risk, warning signs, and protective factors, outline your role in the prevention process, discuss ways for dealing with at-risk youth, and identify additional resources, especially those that are web-based. How pervasive is the problem of youth suicide? Here's a brief review of what national data tells us. Suicide is the third leading cause of death for teens and the second leading cause for college-aged youth. A recent survey of high school students found that almost 1 in 5 had seriously considered suicide, more than 1 in 6 had made plans to attempt suicide, and more than 1 in 12 had made a suicide attempt in the past year. In Georgia in 2013, over 1,000 people died by suicide. 73 of those were youth. Suicide was also the third leading cause of death for 10 to 24-year-olds in 2013. The overarching role of your school in the prevention of any youth self-destructive behaviors is to maintain what is called a competent community. The role of your school is critical and limited and falls within your school's mandate to provide a safe learning environment for all students. Schools must provide the resources and build competencies for helping everyone in the school better recognize kids who may be at risk for suicide. Your critical role is simply to recognize behaviors that may signal risk and then to refer these youth for more comprehensive assessment. In a competent community, everyone is concerned about the welfare of each other and knows how to come to each other's aid. Everyone from the top administrator to the part-time staff and volunteers are committed to suicide prevention and engaged in activities to support this goal, which include providing an effective initial response to these kids and knowing where in the community to refer them for further help. The next part of our competent community consists of education for all staff and volunteers, including administrative staff, faculty, support staff, bus drivers, cafeteria workers, anyone who has contact with students. Suicide awareness training provides them with a procedure which they can utilize when they are presented with suicidal statements or concerns. By having specific intervention tools and an understanding of their role, training like this empowers them to respond to youth's needs in an appropriate and effective manner. The tools which are provided in this type of training also help staff manage feelings of anxiety and fear, which are often generated in these types of encounters. It also reinforces their natural strengths as good listeners and as caring, competent professionals. Staff is helped to understand that it is good professional practice to seek out other professionals as resources while helping the youth to access appropriate intervention services in a timely manner. Houston County has developed procedures to follow for students who are referred to the school counselors. Those procedures will be shared with you at the end of this training. Just as you as educators would not expect mental health professionals to understand educational philosophy or teaching methodologies, you do not need to understand the complexities of mental health classification or treatment. Your role is simple, critical, and limited in scope. To learn signs of at-risk youth and to use that learning, to identify those students, and to refer them to appropriate resources. Are school programs that address suicide safe? The answer? Yes, with clarification. Unsafe programs include things like holding large assemblies where individuals' reactions to the topic can't be monitored, any type of program that depicts a death by suicide, or programs where attempters talk about what they did and why they're glad to still be alive. Can talking about suicide plant the idea in the minds of vulnerable teens? The answer: no. Unfortunately, this question represents one of the most common myths about suicide, that discussing it can give kids ideas about doing it. That's just not true. Just like talking about diabetes doesn't cause diabetes. Whether or not we like to admit it, suicide is a tragic reality in the current life of our students. If you were to ask a classroom of high school students, for example, if they know anyone who has attempted or completed suicide, between 75% and 100% would probably respond affirmatively. Suicide is a frequent topic in the media and is one of the most significant public health problems of our time. Talking about suicide provides an opportunity to address stigma and correct misinformation. It can also enhance coping strategies that help students deal with a long-term social problem. Finally, if you think about the power that keeping a secret can have, you can begin to appreciate how not talking about suicidal thoughts or feelings can actually increase their intensity. Youth need someone who will talk openly about suicide and help them get help finding an alternative to suicide. It also helps them feel less alone. Talking directly about their suicide thoughts tells them that someone cares and is willing to help. And once the topic is broached with students, it's really essential that your school has trained resource staff who can follow up. Remember, your job is simply to learn enough information about suicide to be able to identify students who may be at risk and to refer those students for further assessment. Is talking about suicide just a way for someone to get attention? The answer is no. Talking about suicide is something to take seriously. Sometimes the way youth talk about suicide is indirectly, through their writing or artwork. Pay attention to these types of communications from your students. Ask the student about anything that gets your attention if it is out of the developmental norm or especially violent. Not every inquiry will need follow-up, but if you get an answer that concerns you, keep your eyes open for other signs of suicide risk, which we will cover soon. If a youth talks about suicide as a way to get attention, then you're dealing with a youth whose problem-solving skills are pretty compromised. Suicide isn't a socially acceptable way to solve problems or get attention. Any youth who talks about suicide, whether or not the threat is perceived as serious, should be referred to identified school resource staff. One of the essential tenets in the educational field is that a problem well defined is a problem half solved. In order to ensure that all members of the competent community are on the same page in their basic understanding of suicide, the above definitions are provided. The first definition of suicide is what is accepted by the World Health Organization and the Centers for Disease Control and Prevention. The second definition of suicide is used because it frames the act of suicide in a cognitive behavioral context and suggests opportunities for intervention. Suicide is often viewed as an alternative. Viewing suicide from this perspective helps us understand suicide as less than a wish to die than a wish to escape the intense emotional pain generated from what appears to be an inescapable situation. We might ask the youth, "What's going on in your life right now that has you feeling so terrible you think death is the only answer?" It is really not helpful to present students with the cliché that suicide is a permanent solution to a temporary problem. First, that response is trite, and secondly, the way in which kids perceive the passage of time is different than adults. The future is immediate, like tomorrow or the weekend. So if I had a problem a month ago and I still have it today, it seems like it has been there forever. Crisis thinking colors problem-solving ability. When we think of a crisis as any situation in which we feel that our skills do not meet the demands of the environment, we realize that crises can be frequent visitors in most of our lives. And we can also realize that most of us do not do our best problem-solving in crisis situations. A person who is suicidal is often ambivalent. What this means is that the person is feeling two things at the same time. A part of them wants to die, and a part of them wants to live. When talking with a suicidal youth, we must acknowledge both of these components. While we line up with and unequivocally support the side that wants to live, this can't be done by ignoring or dismissing the side that wants to die. Most of us want to be reassuring and tell someone who wants to die things like, "No, you don't really mean that," or "You've been through harder things before." when the three most important words and the most difficult to say are simply, "Tell me more." Suicidal solution has an irrational component. This is probably the hardest element of suicide to understand, especially from the perspective of rational thought. What happens in the moment someone is suicidal is that their survival instinct disconnects. Even if this just happens for a second, if the means for the suicide are lethal, that's all it takes. Survival instinct is so profound that it is really impossible to conceptualize what must be going on in someone's brain for this primitive instinct to be shut off. Since we can't understand what seems to be this irrational component, it is usually more helpful to talk rationally about the reasons the person may have for living rather than to try to address the irrationality about dying. Suicide is a form of communication. For people who are suicidal, normal communication has usually broken down, and the suicide attempt may be the person's way of sending a message or reacting to the isolation they feel because their communication skills are ineffective. The question that addresses this breakdown can be phrased in the following way: who did you want your suicide attempt to send a message to, and what did you want that message to be? As stated before, there is always a lot of talk about the risk factors and warning signs for suicide, but there is sometimes confusion in how to tell one from the other. It's really important to know the difference because there are many kids and adults who have risk factors for suicide without being at risk for suicide. To make this clearer, let's conceptualize these differences in suicide risk factors and warning signs by using the model of a traffic signal. Consider the risk factors like the yellow light that tells us we need to slow down and pay attention, and the warning signs as similar to the red light that signals we need to stop immediately. There's also a green light to consider. These are what we call protective factors that can serve as a buffer against suicide risk. Let's consider each of these separately. This is the model of suicidal behavior that is called the overlap theory. When we're looking at the yellow light or risk factors, one of the first things to remember is that there is never just one risk factor for a suicide. Every suicide is multi-determined. That means that there is always a combination of interactive factors underlying why the suicide happened. This model has been adapted to include some of the evidence-based risk factors for youth suicide. Let's look briefly at each element individually. Demographic risk factors include age, sex, gender identity, and race. When we're talking about age, youth between 15 and 19 years of age and white males have the highest suicide rates, and African American females have the lowest. As we noted earlier, with children ages 10 to 14, the suicide rates have increased. Sexual orientation and gender identity can be a risk factor because of the victimization, rejection, and isolation that sexual orientation and gender identity can bring. Clinical factors include psychiatric history. Many studies have shown that a large percentage of people who die by suicide had some type of mental health disorder prior to their death. Drug and alcohol use. Obviously, youth who have a history of drug or alcohol abuse are in a more vulnerable category. And previous attempts. A previous attempt, especially when it's combined with other risk factors, is one of the most serious risk factors. Family history. A personal history that includes physical or sexual abuse elevates risk, as does a family history that includes suicide. Recent exposure. Exposure to another suicide, even if it's through media reports or simply the death of a peer by any means, also fits into this category. Recent severe stressors. In combination with these other factors, the experience of stressful life events can also exacerbate risk. Other risks include youth involved in bullying. Current research is supporting the fact that youth involved in the cycle of bullying, from bullies, youth who are bullied, to youth who are both the target and perpetrator of bullying, are at elevated suicide risk. Certain personality factors can also elevate risk. Youth who are impulsive, immature, or anxious worriers tend to have the poor judgment and compromised problem-solving skills, which can increase risk. We also need to be concerned about kids who display aggressive behavior, especially outbursts of rage. Access to means is the most preventative risk factor. A study in Illinois determined that removing access to lethal means, especially guns, was effective in lowering the rate of youth suicides. With younger adolescents, it's also recommended to remove access to the over-the-counter medication acetaminophen, since it is one of the most common medications used in overdoses. And while it isn't always fatal, one of its unrecognized consequences is serious liver damage. This image reflects the way these risk factors must come together in order to escalate to a warning about an imminent suicide. What is helpful about this analogy is that it also offers a clue for prevention. If we change the intensity of just one of those risk factors, the perfect storm of risk no longer exists, and we can get the person the help to stay out of harm's way. And one of the most effective ways to lower risk is to recognize when students are at elevated risk and get them to a resource person who can assist them in developing more permanent risk reduction strategies. The word FACTS provides a helpful acronym for identifying these red lights or warning signs. F stands for feelings: hopelessness, worthlessness, despair, emptiness, feeling anxious or trapped. These are examples of feelings that should really concern us. A indicates actions and includes things like trying to get access to a gun or pills, reckless behaviors, increasing drug or alcohol use, fighting. Changes are indicated by C. This is a very important category because it means we're looking for changes from the student's previous attitude, moods, or behaviors. Students who are active may become withdrawn, quit athletic teams, stop paying attention to personal appearance, daydream or fall asleep in the classroom, or simply cut class. Concentrating on recognition of changes from previous behaviors is the real key to making assessments in this category. Some students actually make or intimate threats, which are represented by the letter T. These can be specific, like verbal statement of intent, like "I'm tired of living" or "I'm thinking of killing myself," or worrisome innuendos in writing or other class assignments. Whether specific or vague, what these threats tell us is that the student is thinking about death or suicide, and that is what escalates our level of concern. Finally, S refers to situations that may serve as triggers for the suicide. While these are not really warning signs, they are the events that might push a youth over the edge. Situations include events like getting into trouble at home, in school, or with legal authorities, personal losses of things like relationships, opportunities, or even of less tangible things like self-esteem or hopes for the future, or any type of life change for which the student feels overwhelmed or unprepared, like moving or the transition after high school graduation. The most worrisome time is between the occurrence of the triggering situation and its resolution, and that period of uncertainty before the outcome is known. These red lights or warning signs are what usually indicate the need for referral or further evaluation. Students at higher risk may be threatening suicide, looking for access to means, talking or writing about death, dying, or suicide, or may have a previous attempt serious enough to require hospitalization. These are the students you want to make sure you refer to school resource staff for further assessment. While the typical procedure for your intervention with a suicidal student will be to make a referral to your school resource staff, you will sometimes be put in the position of having a direct conversation with a student about suicide. Remember that listening is a critical piece of the puzzle. It can be a lot more powerful than talking. When listening, avoid downplaying the situation, as in, "You have a lot to live for. Things will be better tomorrow." If you think about times in your life when you've had a strong feeling and someone close to you ignores it or tells you that you don't really feel that way, you know that this type of response only makes you feel misunderstood and unsupported and can shut down communication for good. Let them talk about wanting to die. It can decrease feelings of isolation and increase hope that someone actually cares. We talked about the question about whether or not to ask about suicide directly earlier in the training. To reiterate, we validated the fact that asking about suicide cannot plant the idea in the youth's mind, but we also reviewed the fact that if your personal attitudes about suicide would make you really uncomfortable or uneasy about asking that question or listening to the youth, this isn't a conversation you want to have. Immediately get the student to someone in a better position to help. Even if the student feels better after chatting with you, you must make a referral to your school resource staff for follow-up immediately. Remember that the student needs to be supervised. One of the most significant protective factors for youth is a caring relationship with an adult. And for many young people, that person is a teacher or someone from school. For a kid, it's knowing that at least one grown-up has your back and will be there when you need them. While it's certainly great if a kid has a village of adults behind them, the good news is that it doesn't take a village. One trusted adult is enough. Other protections include a sense of connection or participation in school or in the community, positive self-esteem and good coping skills, access to care for emotional or physical problems, or for substance abuse disorders. What's significant about this factor is that it doesn't say that the youth has no problems. It simply says that if there are problems, there's also access to treatment for them, and cultural or religious beliefs that discourage suicide and promote self-preservation. Another important thing to remember is that a school that truly functions as a competent community is actually in the position to foster the development of protective factors in its student population. For example, students can be helped to identify trusted adults in their lives and encouraged to participate in school and community activities. They can also be taught, as some current school suicide prevention programs emphasize, that it's okay to ask for help. Students' efforts in school can be acknowledged, something that is critical for students who are marginal performers, and faculty and staff need to be good listeners to both verbal and nonverbal student communication. This training is really just the start of your competence in suicide prevention. You'll want to review your school's policies and procedures to know what's expected of you by your board and administration, but you also want to personally review your attitudes and values about suicide, especially in light of what you've learned today. Ideally, your school would be a competent community when it comes to suicide prevention, where everyone cares about each other's welfare, is aware of potential risk, and knows where and how to get help for those who need it. Finally, take a look at all your curriculum to identify ways in which you can incorporate principles of problem solving, help seeking, and engaging trusted adults as partners, not only as resources for suicidal kids, but for all students to support them through all the ups and downs of their life. The primary focus of this training is simplified in this slide. Remember that your role is learning signs of risk in students, identifying at-risk students, and referring them to appropriate resources. Knowing what to do with your concerns about students is important. Hopefully this training has helped you feel better prepared to help the students in your classrooms struggling with thoughts of suicide. It is also focused on the critical role you play in not just the academic lives of your students, but on your impact on their resiliency, coping, and well-being. Always remember how influential you are in the lives of the kids you work with every day. Please take a moment to review Houston County procedures on homicidal and suicidal threats. The counselors and administrators at your school are aware of these procedures, and this information can also be accessed on the Help menu in TyNet. The Society for the Prevention of Teen Suicide has a free online course for educators. School counselors, nurses, psychologists, and social workers will be participating in a more in-depth training that is available at the site. Others may like to also find additional resources at any of the sites on this slide. Thank you for your attention. We leave you with an Irish proverb that reminds us of why becoming a competent community for suicide prevention is so important, because it's in the shelter of each other that we live. Thank you so much for taking the time to learn how to recognize and respond to suicide. We hope that you are leaving more ready, willing, and able to identify and respond to youth at risk for suicide.